Good afternoon. A warm welcome to all of you. Dear students, let us learn how the anesthesia specialty has come up. Anesthesia has come up as a modern specialty. So, the agenda of my talk was, how was anesthesia or the pain control or operative activities were carried out before 1846, and anesthesia from 1846 to 2000, and 2000 to till date, and future of anesthesia. Before 1846, there was no specialty called anesthesia. There was no term. The patient's suffering used to be treated only by the medication or herbal treatment or some means of the treatment with some medication. Surgery was not considered as a usual modality of treatment. It was considered as a last resort because there was no control over the agony of pain. Usually, the surgical procedures were for the amputation of the crushed limb or cutting a stone. The speed of the surgeon with which he finishes the operation was considered as the skill of the surgeon. Usually, the patient, the person suffering, was getting controlled by various people and strapped, and surgeon used to come and cut the particular limb. Many patients used to lose their consciousness and die, and it was not possible to argue at that time, like why the doctor has done like that. They used to consider it as a fate, and sometimes they used to give alcohol or some sedative drug and poppy seed juice, and they used to carry out some of the last resort procedures. So it was horrible. You can see the person, they used to cup and cut, they used to control the person, this one, and surgeon used to come and cut the part. It was unspeakable agony to unlocking consciousness. On 16th October 1846, a successful control over the pain was demonstrated by providing a state of analgesia by W.T.C. Martin, is Dr. Martin, and surgery was carried out by the famous surgeon John Collins Warren, and the patient did not feel pain, and that was considered as a successful demonstration. Sir Oliver Wendell Holmes called this as anesthesia. Anesthesia. No. Pain condition. Certain milestone. Let us go through the milestones. It was Joseph Priestley who discovered oxygen in 1774. Lavoisier called it as oxygen. Thomas Bodies introduced oxygen therapy, and Haldane and Backward introduced the modern oxygen therapy. So oxygen was discovered, its importance was known, it is essential for the metabolism was understood, and subsequently the oxygen therapy started. Joseph Priestley again discovered nitrous oxide in 1773. This nitrous oxide was used by Gardner Quincy Carlton to provide a euphoric condition. Under the effect of inhalation of nitrous oxide, the persons never used to feel any pain, any injury, if at all they come across by fall or crushing, laceration, they never. Then they used to, this Quincy Carlton used to carry out some shows. And these were called, this was called as a laughing gas, and laughing gas shows used to be conducted. And once for such show, Dr. Horace Wells attended in Connecticut. He was a practicing dentist. When he was witnessing the show, one person had a fall, severe laceration of the limb, but he didn't feel pain. He was astonished. He was practicing dentist, so he thought of, why can't I try this methodology for controlling the pain for the tooth extraction? So he went to Carlton, asked him to provide anesthesia, provide this modality of therapy next day in his clinic. He accepted, and Carlton gave him the inhalation of nitrous oxide. And John M. Riggs extracted the tooth of Horace Wells. Horace Wells didn't feel pain, and he enjoyed. He thought of practicing this modality for treating his patients. He carried out many tooth extractions. Then, in order to get the credit of discovery, he invited the so-called the famous physicians of those days, to the Massachusetts General Hospital for public demonstration. It was in 1845. He went for the demonstration, and the procedure was carried out. But when the procedure was being carried out, patient screamed almost at the end of it. Everyone laughed. What is this foolishness he has done? So they made fun of him. And majority of the doctors left the demonstration hall. Afterwards, when the patient or the person who underwent the procedure was asked, how was the pain? He told he didn't feel the pain. But the damage had occurred to Haraswells, and Haraswells got frustrated, and then his life ended in a tragedy. Okay, there is a history I won't want to spend time with regard by discussing or spending more time on that. Then W.T.G. Martin, who was also a dentist, who has worked with Haraswells, he was continuing his practice. Then he used some liquid, and it gave the anesthetic, the effect of adequate analgesia without the knowledge of the patient, which is called the hypnosis. Then Dr. W.T.G. Martin came up for the demonstration in the Massachusetts General Hospital. The same dignified physicians of those days. It was on 16th October 1846, and this what we discussed. The operation was carried out on the neck of a person by name Gilbert Abbott. Patient didn't feel pain. Then famous Dr. Warren declared, gentlemen, this is not a humbug. And the conquer over the pain has occurred. And for this, Oliver Wendell Holmes coined the term anesthesia. Present in that room was Dr. Jacob Bigelow, who was from UK. He wrote a letter to his friend in London regarding this discovery. The news spread to UK, and the practice of this pain control started in UK. And so 16th October 1846 is considered as a success. And in UK, in the subsequent year, along with the ether, some chloroform was being used for providing control of pain for the obstetric patients by Sir James Simpson. But in those days, the labor pains were considered as a gift given by the God, which is essential the woman should tolerate for the benefit of that family, for the progeny. So the community was not accepting it. But when Queen Victoria was pregnant for her 7th child, she was not ready to accept, so bear the severe labor pains. So she told her officials to get the famous doctor who can relieve her pain. It was Dr. John Snow, who was famous as a father of epidemiology by discovering the cholera pump. He was an epidemiologist, and he was also practicing anesthesia with chloroform. So he was invited. He provided anesthesia to Queen Victoria, and Victoria Queen didn't feel the agony of pain, and she was very happy, and she declared it was a gift given by Dr. John Snow, and the woman should be provided the pain relief during her labor. And subsequently, John Snow was considered as a father of anesthesia in UK. But because chloroform was more cardiotoxic, there were more deaths, and subsequently the practice of chloroform was stopped. There was a Hyderabad commission in India with regard to the death of the patients undergoing anesthesia with chloroform, and subsequently it was abandoned. Then in 1929, the cyclopropane was most widely used for general anesthesia for the next 30 years. Then in 1956, halothane was discovered with a team effort between British Research Council and chemists at the Imperial Chemical Industries. And it was considered as an ideal inhalational anesthetic agent. For almost half a decade or so. But halothane is associated with halothane hepatitis because of its metabolism, and liver toxicity. Repeated exposure of halothane resulted in halothane hepatitis. So nowadays it is not commonly used anesthetic agent. and it gave way for the discovery of the newer anesthetic agents like sevoflurane, isoflurane, desflurane. So these were the agents who used which were used for inhalational technique. But the advances in the industry and medical knowledge resulted in a newer ways of providing the requisites of control over the pain for the surgery. Then came the term balanced anesthesia. So anesthesia involves three types: unconsciousness, no pain, analgesia, unconsciousness, anesthesia, unconscious, no. Then analgesia, no pain, and amnesia, no recovery of the incident that happened, with sedation. Along with that, the muscle relaxation, wherein the paralysis of the skeletal muscles, which will avoid the resistance and unnecessary movement which during the operation, which was essential to avoid unnecessary injury to the tissues. So these modalities, when combined, it is called as balanced anesthesia. Anesthesia, amnesia, analgesia, and muscle relaxation. Balanced. So achieving all these modalities with the single agent can cross the therapeutic effect and it may become lethal. So advances in the field of medical sciences resulted in the discovery of newer and newer drugs for the various purposes. So intravenous anesthetic agents were discovered like thiopentone. And I told balanced anesthesia involves sedation to relieve the anxiety, anesthesia, unawareness, analgesia, no pain, muscle relaxation, lack of response. With regard to the drugs, then so like that it is. With regard to drugs, I will give a brief account. Then we'll go to the different ways, different techniques, how they were adopted. Okay. They came along with the inhalation type inhalation agent thiopentone, intravenous agent thiopentone sodium, newer intravenous agents like ketamine, propofol, now etomidate were introduced for providing the intravenous anesthetic. For muscle relaxation purpose, hexamethonium was introduced in 1944. It is a non-depolarizing, it is a depolarizing muscle relaxant. Rapid in onset, rapid offset. Very shorter duration. So for the longer duration surgeries, newer non-depolarizing muscle relaxants were discovered. To start with, it was ergot, and now newer non-depolarized muscle relaxants like pancuronium, vacuronium, rocuronium, atracurium are used. Simultaneously with the discovery of drugs, there was a discovery with regard to the means of providing the inhalational agents for providing inhalational anesthesia. To start with, it was ether bottle and the mask, Yankar mask. Bellamy Gordon's bottle, and which ether used to be poured, and the mask covered with the gauze piece was used to be put on the patient's mouth and nose, and patient used to inhale, and they used to go under the inhalational anesthetic effect. And that is unconsciousness. And the sophisticated vaporizers were not. The liquid was getting vaporized, and that was causing the effect through the inhalation, its target organ on the brain. So there were no sophisticated equipment, and subsequently the temperature controlled vaporizers were detected. Nowadays, like Oxford miniature vaporizer and halogenated compound like halothane, sevoflurane, and nimerdesflurane. For that, take vaporizers were introduced. Presently available modern vaporizers advanced in their construction, capable of delivering a precise, predictable, and calculated constant concentration of the volatile anesthetic agent. The delivery system, anesthesia delivery system, gas delivery system. Chuck Boyle's machine was invented in 1970. It was a primitive machine, and the requirement of controlling the vital parameters, their monitoring, and record keeping, and made the scientists and the industry to carry out lots of research development activities, and this has resulted in the modern workstation. It is called workstation because here what are all the things that are required to carry out the activities in providing the anesthesia can be accommodated. So there is a space for keeping the drugs. Then the circuits which are this sophisticated circuits with the inspiratory and expiratory limb, with the mechanical, with the machine, the ventilator, anesthesia ventilator. And in order to prevent the loss of the anesthetic agents and air pollution, reusing the unused, reused in the exhaled anesthetic agent, the sodium, the circle absorber, then scavenging system to collect the exhaled gases in order to prevent the hazards associated with the anesthetic agents. So this is the modern workstation. In the last 20 years, anesthesia advancement is tremendous. Drugs, machines, and better education have led to the most safest anesthesia practice today. It is hardly to think about anesthesia related deaths nowadays. Almost all surgeries are done because of the modern anesthesia drugs and techniques. With anesthesia information management system, with the integrated support, target controlled infusion systems, better design of the anesthesia machine, closed loop delivery of anesthesia, and point of care ultrasound. The advances have happened. The surgeries are being carried out as ambulatory surgeries or daycare surgeries in order to reduce the cost, reduce the length of stay in the hospital, making the patients attend to their working role at the earliest. Nowadays, improvement in the surgeries have happened because of the advances in the anesthesia, endoscopic surgeries, laparoscopic procedures. And because of the development and monitoring facilities, the post-operative care has improved a lot, and needy and complicated post-surgical care for the needy and for the needy and the patients landing up in the complications because of the instability due to various conditions of the disease process or the complications of the trauma. They will be better handled in the intensive care unit or intensive trauma care unit or high dependency care unit. This has happened because of the advancement in our understanding of the problems of the patient and the problems associated with the procedure, problems associated with the drugs which have been conquered because of the progress in anesthesia. Present anesthesia shows newer drugs in the present day. The drugs with additive effect like Heptiva having anesthetic and narcotic, Duzitol anesthetic, narcotic and muscle relaxant, Remime, Zolom narcotic and benzodiazepine, and newer reversal agent for rocuronium and vecuronium, mainly rocuronium, Sugammadex, and xenon is the newer ideal inhalation anesthetic agent expected to take its role as an ideal anesthetic agent. Research and advances have improved our skills in various techniques. Of providing anesthesia here. So, much of the advances or the researchers have shown head elevation beyond the sleeping position for the better and easy intubation. Closed loop anesthesia. And monitoring facilities have definitely given a fruit, and a safe anesthesia is possible. Robotic surgeries are our hopes for the better care. Artificial intelligence is going to have its role in the future. Newer therapeutics, central nicotinic analgesics derived from the amphibian skin. Prototype is epibetadine. Its efficacy is equal to that of the morphine. It is expected not to have any effect on the ventilatory depression, no physical dependence. Patient comfort is a priority in providing anesthesia. Smart pumps are the future. So the present operation theater is a operation complex or operation room is a well equipped, safe zone for providing anesthesia for the simple to the complicated surgeries, including the transplant surgeries, robotic surgeries. Advanced cancer surgeries. So we have to remember this great man who on 16th October 1846 gave the first ever public demonstration of anesthesia using a sulfuric ether with the Martin's inhaler in the ether dome at Massachusetts General Hospital, Boston. And ether dome is in his remembrance in the Massachusetts in Boston. William Thomas Green Morton is inventor, revealer of inhalation anesthesia, before whom in all time surgery was agony, by whom pain in surgery was averted and annulled, since whom science has control over the pain. So anesthetist will take care of every breath, every beat, monitor every beat, every second. We are there for the safe anesthesia, safe surgery, and safe patient. Thank you. You are welcome for your queries so that we can clear our doubts.